For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good afternoon. My name is Corina Herrera Loera, Public Information Officer for the Emergency Operations Center here at the County of Santa Clara Public Health Department. Welcome everybody to our bi-weekly community forum. This week we will have Doctor Solorio Cortés with us, but before we do that, we will go ahead and present the information for this week. Welcome. Thank you, Gloria, for being in the background and supporting us with sharing the slides. Next slide, please. So our update for today is 83.7% of all of our residents of all ages have been vaccinated. 3,082 is our new cases 7-day rolling average. We do know that our cases are going down, so that is a good sign. However, we're still obviously not clear from COVID-19, and we are still continuing to monitor that carefully. So just continue to wear your mask and do what we're doing to stay clear. On a personal note, I'm just ending my 10-day quarantine today. Luckily, very mild symptoms, and I attribute that to the vaccine. But I'm happy to be here with you all. Next slide, please. And so if you have any symptoms or think that you've been in close contact, please make sure to get tested. So if you have, as I mentioned, known exposure to someone with COVID 2 to 5 days ago, especially if you are unvaccinated, and that will give the ability to be able to provide the treatment that you will need. So I think anybody should know if you are positive, but especially if you're not vaccinated, so that you don't have any severe symptoms, hopefully, if you do have COVID. And you should get a COVID-19 test if you have new symptoms such as fatigue, headache, body, muscle aches, cough, fever, sore throat, and or congestions. And you should get a COVID-19 test if you have symptoms and are at high risk for severe illnesses because of other medical conditions, age, or have a compromised immune system. You may qualify for treatment to reduce your risk of severe illnesses, as I mentioned. You can schedule your test at scfreetest.org. Some of you were tuned into our press conference this week, so we are encouraging people to go to their insurance providers such as Kaiser, El Camino, the different insurance providers, the folks that you go to for medical attention, to schedule your appointments through there, which will come in to be in an update to the new health order next week, and we will be having an update on that on February 16th as to the details of that. In the meantime, you can continue to schedule your test at scfreetest.org, but we do encourage you to go to your medical providers. Next. And please visit sccstayhome.org for isolation guidance. We will be going over the guidance today with the doctor, but if you were exposed to someone with COVID-19 as a close contact and you're wondering now what, we do update our isolation guidance regularly, if, depending on the changes. If you have symptoms or test positive, regardless of vaccination status, please follow the isolation guidelines. Visit sccstayhome.org for more information on isolation support services. And as I mentioned, I will be guiding you through our dashboard on how to access our isolation guidance that we currently have in our county. Next slide. And can you get vaccinated even if you have COVID-19? That's a question we've gotten often, and the answer is yes. You can get the vaccination, but you will have to wait at least 10 days after your quarantine has passed in order to have your vaccine. So we do encourage folks to get it ahead. Don't wait to be positive. Don't wait to lose somebody. Don't wait to have any severe illnesses. But if for some reason you are not vaccinated and do get COVID-19, you are able to get it 10 days, at least 10 days after your quarantine has passed. Next slide, please. And in regards to your children, if they're feeling sick, please don't send them to school or daycare if they have any of the following symptoms: fevers or chill, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, new loss of taste or smell, sore throat, nausea or vomiting, or diarrhea. Find a place to get tested, as I mentioned before, at scfreetest.org. Next slide, please. And in regards to masks, we are still following the mask mandate. We are in Santa Clara County. We are still wearing our masks. So please upgrade your mask if you haven't done so. Consider getting a mask with filtration and comfort. The surgical masks are good. The KF94 and KN95 are better. They're surgical and cloth. And the best are the N95 if you do have access to those. Fair, if you only have the cloth mask, it's better than no mask. But these are, the different rates of the masks. So we do encourage and we do recommend, the best one is the N95 if you have access to that. Unfortunately, myself, I don't. So, according to the CDC, double masking is up to 95% effective. So if you don't have an N95 and, you're only able to get cloth masks or the surgical mask, then, do the double masking and make sure to continue to mask to help protect yourself and others around you. Next slide, please. And as we know, Valentine's is coming. We're here in February now. Make sure you're spreading love and not COVID. And just a reminder, there's no community immunity without you and I. I luckily got, COVID, but very mild symptoms, and was able to quarantine. I know it's very hard, when you're not, for whatever reason, whether it's living in a home, with several people, whether it's you're working where you're not able to take days off. I can't imagine. But we need to continue to do our part in order to end this, right? Get to the point where we're at an end of this pandemic, and that we're able to be clear and stop hearing about, new variants or something else. So just want to remind you all, put your questions on there in regards to what we're talking about today. I do want to bring up, and I think that's the last slide, right, Gloria? We can go to the next slide. Just want to confirm. Oh, no. Of course, our resources, want to make sure that you all have the resources that you might need. Here are different numbers. Vaccination Call Center, 408-970-2999. Know Your Rights in the Workplace, 1-866-870-7725. Mental Health Services, 1-800-704-0900. COVID Support Line, 808-7770. Or you can call the call center at 211, or send a text if you're better using text to COVID-19, or saying COVID-19 to 211-211. So if you text COVID-19 to 211-211, somebody will respond to you. And then we also have the crisis hotline 24/7 available, the 1-855-278-4204, or text renew to 741-741. You never know who might need these resources, so I suggest you write them down, or at least that you know that they're here, and you can rewind the video and write these down, because it might not be you who might need any one of these resources, but somebody you might know, or you might need them in the near future. I know this pandemic is affecting all of us in one way, shape, or form, and some of us more than others, so there are some numbers in case you might need them now or in the near future. Okay, and I think that's the last slide, Gloria. Thank you so much. And now I am going to bring the doctor in. And what we'll do with him is we will review the quarantine. So I'm happy again to bring our Doctor Solorio Cortés. Gerardo Solorio Cortés is with us today, and he is with the Gilroy site, our Valley Medical Center. Let me bring him in. Welcome, Doctor.
Hi.
He is a primary physician out there and working with our South County folks, providing them with resources and services, and also here with us once a month to give the most updated info, and then also to be able to provide any answers to questions out there. So if you have any questions for Dr. Gerardo Solorio Cortés, please make sure to put them in the comment in specific to the information that we will be providing today. And then, I will go through the questions at some point and answer, get to answer hopefully all of them in relation to what our topic is today. But before that, Doctor, are you okay with if I share my screen? I'm going to be going over the isolation guidance. I know that for me, I'm sorry, as I bring it up, for me, when I got the positive test, right? I was like a deer caught in, with headlights on. Like, I had no idea what to do. I'm here providing the information, and I was like, what is that again? So for me, this was very helpful to know exactly what the guidance is, step by step. And so let me share that. All right. So I'm going to share. These are on our Santa Clara County dashboard. So if you go there, I will guide you through it, just because you might not need it today, and at some point you might say, where was that again? So you go to the dashboard, and then you'll see here I have highlighted home isolation and quarantine guidance, and then you will see the guidance here, and there will be a long explanation on each and every one of them. So what I'm going to do, this is more for visuals. I will go through the guidance. So I'm going to read specifically: for persons who test positive for COVID-19, regardless of vaccination status, previous infection, or lack of symptoms, should isolate and stay home for at least 5 days. Isolation can end after day 5 if symptoms are not present or are resolving, and a diagnostic specimen collected on or day 5 or later tests negative. So just to say that diagnostic specimen is a fancy word for an antigen test. So the home tests that we have been receiving from the federal government, from the county, and some of us, were able to order some, that's your antigen test. So just make sure it reads antigen test. So that's that diagnostic specimen. If unable to test or choosing not to test and symptoms are not present or are resolving, isolation can end after day 10. If fever is present, isolation should be continued until fever resolves. If symptoms other than fever are not resolving, continue to isolate until symptoms are resolving or until after day 10. Wear a well-fitting mask around others for a total of 10 days, especially in indoor settings.
And if you don't mind, Karina, let me just chime in terms of like the symptoms. Some people may still have loss of taste, loss of smell, and that wouldn't count on a symptom that would keep you in isolation or isolation. That's symptomatic. It's the big one again. You stated beautifully, is the fever. Not having fever for the last 24 hours and not requiring, a anti-diuretic medication like Tylenol or Motrin.
Thank you. And that actually is very helpful, because me myself, right, I still don't have taste, and I've talked to some friends who say that lasts, actually, the loss of taste, which are things we don't talk about, right? Like these things, now that we know more and how it's affecting us, that can be a long-lasting symptom, and who knows how long, right? Some people, I heard 6 months it lasted for them after they tested positive. So thank you for sharing that.
And then one last point, since we're talking about the antigen test, and I know we've discussed it in previous forums. The reason why we do the antigen test to get out is because that one will be positive when there's active COVID in the patient. Meaning, if we do the nose test and it's positive antigen, that means the patient is still infectious. This is very different from the PCR. The PCR, it could be repeated at day number 11, and it could be positive, but then also have a negative antigen. And the reason being is because the PCR also catches dead particles, and that's just nature. That the infection has left the patient, but there's still dead particles of COVID that the PCR will catch. So that is why it is not recommended to recheck in the next 90 days, because potentially that PCR could be positive. So antigens always going to be the best to get out of isolation.
Okay, and doctor, I'm getting some feedback that I think there's still some echoing happening. So I don't know, maybe turning let's try your volume down a little bit. Let's see if that helps. We'll see. And maybe I need to mute when you talk as well. We'll try that as well when you talk. Okay, and thank you for explaining the difference between the PCR and the antigen. And I think, which is part of the reason, for example, me as a Kaiser member, they are not testing me for 90 days from PCR, because most likely I will test positive for the PCR test for about 90 days, versus that antigen is what is catching in the moment. So yes, thank you for breaking that down. Okay, I'm gonna go back to now number 2, and again, the guidance are here, the different ones that I'm reviewing. You can go in there and look at them, but I will go over persons who are exposed to someone with COVID who are unvaccinated or vaccinated and booster eligible but have not yet received their booster doses should quarantine and stay home for at least 5 days after your last contact with a person who has COVID-19. Test on day 5. Quarantine can end after day 5 if symptoms are not present and a diagnostic specimen, so that antigen test I was talking about, is collected on day 5 or later. Tests are negative. If unable to test or choosing not to test and symptoms are not present, quarantine can end after day 10. Wear a well-fitting mask around others for a total of 10 days or more, especially if in indoor settings. And if testing positive, follow isolation recommendations above, the ones I just mentioned. And if symptoms develop, test and stay home. And then on this last one, I developed symptoms of COVID-19, and what do you do? So on that one, persons who are exposed to someone with COVID-19 who are boosted or vaccinated but not yet booster eligible do not need to quarantine, but should still, so if you have symptoms, let's go back to this one. If you do have symptoms, go home right away, get tested and stay home until you get your results. Once you got your results, if you are positive, follow the isolation guidance that I went through in the beginning. If you're not positive, if the result is negative, are you fever free, and are your symptoms improving? If it's yes, are you a close contact? If it's a yes, follow the quarantine guidance. If you're not a close contact, you can go back to work or school. If you are not fever free, stay home at least until fever free and other symptoms are improving. So that is that one. There's so many differences, but again, I don't expect you to memorize them other than to know where to go back to review and make sure that you are following which one applies to you. So persons who are exposed to someone with COVID-19 who are boosted or vaccinated but not yet booster eligible, you do not need to quarantine, but should still test on day 5, wear a well-fitting mask around others for 10 days, especially in indoor settings, and if testing positive, follow isolation recommendations above, and if symptoms develop, stay at home. Now, there's a lot more explanation, a lot more information if that is something that you might need, but I did want to guide you to show you where those details are. If you tested positive, if you're confirmed a close contact, or if you develop symptoms. Thank you so much. And now let's try to bring back our doctor and see if we're better on the echoing. Welcome back, Dr. Solorio Cortés.
So, can you hear me?
I can hear you. I'm hoping that the echoing on the audience is better. I can hear you fine, so I'm not sure, but let's try it this way. So we're going to go to the questions, unless you want to add anything to that, Doctor, before we move on to
No, this is good. Let's move on to the questions. You did a great job. Thank you, Karina.
Great. Okay. Thank you. So let's see. We have Beppo, who's mentioning, get the booster, which doesn't work with Omicron and doesn't prevent getting sick or transmission. Why not wait for the Omicron specific vax? I'm not too sure. Doctor, do you know anything about the Omicron specific vax or anything in relation to that?
It's a very excellent question. Thank you so much. I mean, I think at this point, even with Omicron, the variant that we've had in the last few weeks, the vaccines we've had and the boosters have been effective at preventing hospitalizations or severe disease. Now, the question about Omicron specific vaccine, that's being looked on right now with Pfizer and I believe Moderna. So that's more to come. And you're right, that'll be more of a specific Omicron vaccine. But what we have at this moment, be it all, Pfizer, Moderna, Johnson & Johnson are very effective at preventing severe disease, hospitalizations, death.
Thank you. Okay, I'm going through the questions here. We have Simon Gordon, who says, or is wondering if Santa Clara County will be giving out any more tests. Good question, Simon. As far as I know, as soon as we've gotten the shipment in, we've been giving them out to the community. As far as I know, there's we don't have. As soon as they put out the word, then that was that weekend. We ran out of the tests. Everybody signed up. Great. And when we got a new shipment in, we put the announcement out and people signed up and picked theirs up. Now, I don't know if we're going to be receiving any additional shipments. We might, I'm hoping. Otherwise, for now, if you haven't signed up for your home on the federal government side, make sure you get those as well. But for now, I don't know of any new dates of when Santa Clara County will be giving any more tests out. Do you have any additional information on that, Doctor?
No, I think the biggest thing is the supply, and that comes more from the federal levels. As soon as we get more, I'm proud of our county that we're proactive and probably do a little bit more than other clinics when it comes to vaccinations and testing, and now with the home kits. So as soon as there's more quantity, I think we'll distribute it to our county population.
Thank you. And we have Olga Subega here, who is wondering, in a child, if they have no fever but cough and congestion, also still testing positive, do they still need to isolate?
Definitely, yes. A positive test is what's telling you that
we're dealing with COVID, and you would follow the algorithm that Corina mentioned, with a positive person, including a child as well.
Thank you, doctor. Okay, let's see. And then she says that is testing positive after day 5. So similar, same. Yeah. Okay.
Yeah. And I'm glad that you mentioned that in terms of the where you're at the dates, and pretty much that's what CDC says, that if you're still positive after day 5, let's assume it's day 6, then they would still recommend that you finish it off with the 10 days of total isolation. Definitely.
Perfect. And then we have Kim Jo Renslow, doctor, and maybe it's another opportunity for you to explain the PCR and antigen, who's saying they will test positive for 90 days after having COVID.
Yeah, thanks a lot for the question, Kim and Corina. I think it's a common theme, even if, last night, as I was researching the latest, data, and also looking at, different, the numbers in different countries, the question about testing, home antigen test, PCR testing, it's even, I would say now we're more comfortable as clinicians, but initially, it's something that we had to look up. What does it mean to be positive on a PCR test? What does it mean to be positive on these antigen tests? And as I mentioned, pretty much the PCR test, could catch, once you've been infected and you want to repeat that PCR test, it could give you a positive test 1 month later. But studies have shown that it pretty much, if it's a PCR test, it means most likely that it's a dead virus, dead particles that could still stick around, not cause any issues to the health of the patient, but it's just the way science is and this test is. So that's what PCR is not recommended subsequently. The antigen test is because it's catching active formed protein, which means basically that's active infection. The PCR, just to clarify, the PCR does more of a genetic analysis. So once doing the genetic DNA, RNA level, PCR, the other one's antigen is more of the protein formed infection. And that's what we care about when we want to end an isolation. We want to make sure that is negative.
Thank you, doctor, for explaining that. So the antigen test, that rapid test, I know Olga was wondering again with the rapid test. That is the antigen, the rapid, the in-home, the ones you're receiving from the federal government, from the county, the little boxes you take home. And the PCR tests are the ones that, for example, Kaiser.
You go to clinic,
and you take it there.
And just to add one more tidbit is, we love the PCRs because PCRs will catch earlier, less symptoms COVID disease. These and thank you, Olga, these home rapid tests, there could be a false negative in an individual who's early on the actual infection with minimal symptoms. We probably will miss it. So that's where PCR comes in. If you're around someone exposed, or you have this doubt that you have this minor symptoms, that the antigen test at home is calling it negative, and you say, well, is there a test that would be more sensitive? And that's the PCR test you do with the clinic, Kaiser, or in my or at the ER, or in our the ones that come back in 24 hours. The ones that come in 15 minutes, we're talking about the antigen tests.
Thank you, doctor. And I'm glad that people are asking questions. Well, we have Kim Jo Renslow again, because it makes for others out there that have the same question. So he's wondering, should you stay home even after you have had COVID within 90 days? And so I know that's tricky, doctor, because I know that I had a situation in my home in the last 10 days. And so I think, yes, I don't know how you'll answer it, and then maybe I'll explain a little bit in my personal experience.
Once you have COVID, it's very unlikely that you'll get, the science says that it's very unlikely that you'll get reinfected within the 90 days. But, it's now, and then 1 month later, you start losing your taste, your smell, and you did positive PCR 1 month ago. The question would be, how do I decipher that and say, do I have a reinfection of COVID within 30 days? It's possible. And the recommendation is to do the antigen test. So if you have symptoms and a positive antigen, most likely you are in one of those less like rare conditions where you're reinfected. And that's why the antigens is better at catching the now I have the active infection.
And then I'll share my personal experience in my home. My husband had tested positive in December, early December. He did his quarantine. He was clear, and tested a couple weeks after his quarantine. He was negative. He tests regularly for work, so he continued to be negative. And then about a month later was exposed again, and in an antigen, after testing negative within the last month, tested positive again. So as the doctor mentioned, the antigen test is the one that's going to catch it in the moment. So it can happen, but in the meantime, you follow the guidance that you get. So if you test positive on the antigen, follow the guidance again, and finish it through.
And Karina, you're mentioning, and I'm glad that you're having, and thank you again for sharing your experience. One thing with COVID is we're given, the latest evidence, guidelines, general, real, the truth in terms of what to do. But there's always going to be nuances. For example, if a patient, was PCR positive 2 months ago, but then at work, they did those PCRs. They were negative at 1 month after. But let's say 2 months after, there's exposure and there's a positive PCR. Most likely it's reinfection. And then you would do another test to do the antigen. And if that's positive, then for sure it's a reinfection. So, talking with your healthcare clinician is also very important.
Thank you so much. I know that when I mute is when you're able, so I'm gonna a little lag there. So I do want to remind folks, right, to make sure to read, in the SEC COVID, the dashboard, the guidance that I went over. If you're in a situation, go back to that, see which one you fall under, and follow that guidance. And know that, when you go back there, that guidance has changed in the past 2 years, right? Initially it was different. There's been days that have been, it's gone down. For example, I remember a time when it was 14 days, I think, if I remember correctly.
You're right. Yes.
And now it's 10 days. So we will update that to make sure that we're following our county guidelines, which, with CDC and ours, ensuring that at the end of the day we're all
and Karina, I don't want to forget. We're talking about, we're assuming that people are infected and are at home, the 10-day, 5-day, but this doesn't apply to people that have been admitted to the hospital or been in the ICU, intubated, where the days could range from 10 to 20 days. So again, that would need a discussion with your healthcare clinician. And then lastly, for people that have an compromising condition, like receiving chemotherapy or receiving immunotherapy for other health conditions, they might need to be quarantined, isolated for the full 10 days, because studies have looked at that the antigen, for example, antigen test will be positive in those individuals even after 5 days. So again, a good talk with your clinician is also very important, especially for these two populations: people that have been admitted to the hospital, and also if you suffer any immunosuppression condition.
Thank you, doctor. And we're gonna have Gloria just kind of put that dashboard website that I went through earlier, so you can go to it, you can follow the guidelines, you know, again, look specifically as to where you fall, because I do see a question there from Kim Jo again. So if you have been exposed, should I stay home? I should stay home. And the answer is yes, and follow the guideline. So you don't necessarily have to quarantine depending on your situation. So thank you so much.
And the vaccination status is very important.
Yes, and that's on the guidance. If you are boosted, if you have the vaccines, and if it's a yes, if it's a no, and it'll guide you exactly as to what you need to do. So please go there. You know, you might not be exposed today, you might be exposed next week, and you'll be like, oh, I remember them talking about it. Let me go to it. So yes, thank you, Gloria, for putting that on there. Okay, we're going to go to the next question here. Let's see. Olga. Olga, I see you having a conversation there with Kim. I'm glad you're all communicating, but you brought a very good point in regards to schools. Schools do have a different, they can have a different guideline depending on the district. And so I'm glad you brought up schools. If they are requesting a rapid test after day 5, then that's what that is. If positive, then they have to stay home. So I'm trying to get clarification, and that's good, because in regards to the schools, that might be different. I know on my daughter's, it's very similar to the county, but instead of day 5, they want day 7-ish. 7 days. So it was like 2 days, I think, if I remember correctly, on their decision tree, it was like 2 days after day 5, which makes sense because I think it's more accurate, right? Whether it's a negative. So my daughter, I'll give you an example. She had quarantine. She was quarantined. On day 5, she tested positive still. On day 7, she tested negative. So she was able to go back. And so that was a decision tree based on the school district. So check in with your school districts, because they might have a different guidance. But for the most part, I think it's at 7 day that they ask the students to test, because most likely at that time, the students will test negative, like my daughter did. Okay, so we have a question from Maria de la Cerda. What about people who received the J&J vaccine and 1 Moderna booster? When can we get a 3rd booster in Santa Clara County? Do you know?
Well, that's still, in the works, kind of like the other question about is there an Omicron specific, vaccine? There's more to come in terms of when and if a second booster is going to, be needed, like 5 months after your first booster, or seasonal, like the flu shot vaccine. We still don't know, but I know, all these, specifically, Moderna, Pfizer, BioNTech, and J&J are looking into that when and if we'll need our next booster.
Thank you, doctor. I'm going to the questions. I have another question from Kim Jo. So do I isolate when I'm exposed after having COVID? And then he says, even though I have had COVID.
It's a good question. It depends, Did you have, especially like, for example, in homes where there's multi-generational, multiple people, they're in different steps of their isolation, quarantine. So there's going to be exposure and such. So the question is, are you talking about that you were infected recently and you were exposed, 3 weeks, 4 weeks later? That's, for example, one hypothetical scenario. Or are you talking about you had COVID in August of 2021, and now you've been re-exposed, you're not vaccinated, or you are vaccinated? See, all these variables would determine, what do we do? Do we quarantine? Do we not quarantine because you're vaccinated and, you know, still wear a mask and get tested at 5 days? Or do you stay at a quarantine place for 5 days? So there's, you know, different scenarios.
Thank you, doctor. And then he mentions pool testing at my school does not test me for 90 days. So I will PCR test myself. Thank you for explaining. And I think that's the key there. Kaiser will not test me anymore for 90 days either, because I tested positive. So 90 days after my positive, they will not test me. So the only way, say in 2 months, I feel like I got, you know, I know that I got re-exposed, I'm having symptoms.
Yeah.
I will have to do the antigen test to know in that moment. Right?
Exactly.
Okay. Perfect. And we have Jody G, who's joining us from YouTube. Thank you. What are your requirements for dropping the mask mandates? Doctor, I don't know if you know any of those details.
I mean, just in general, with Omicron, you know, it's, the data was saying, and it's saying it's more contagious. You look at severity, maybe not as high as Delta or back in 2020 with the original strain, but the issue is, you know, number one, there'll be a lot of sick people, which will include essential workers, and that would affect, you know, just society in general. So I think public health takes into consideration how infective that strain is, how many, you know, hospitalizations we have in our hospitals, how many deaths, and if our, you know, vaccines and therapies are working or not working. I think taking all that data determines when, you know, masks will go, you know, off. I'm not a, you know, public health professional, but I do. I mean, those are the variables that those healthcare professionals and officials look at to determine, you know, mandates for masks and such.
Thank you, doctor. And then we have Olga again, which I really appreciate your questions, all of your questions, but specifically as detailed, because I'm sure you're not the only one with the questions. So she's wondering, if one sibling tested positive a week ago and the other tested positive 6 days later, is it wise to keep them in the same room? Will it keep the first sibling from testing positive, or should they be separated?
Excellent question. So quarantine and isolation, we're always going to recommend, if your current living situation allows it, where you have a separate room, separate bathroom, that's always going to be the best scenario. But as we all know, that's it's, for many families, that's not possible. So the next best thing is to, you know, wearing a mask in these multi-generational settings, homes. That'll be number one. Number two, try not to use, you know, same utensils. Number three, for example, showering the person who has the positive infection to do the cleaning, disinfecting afterwards. Sleeping situation, if there's no separate room available, at least trying to keep 6 feet away will be helpful. Ventilation as well will be very helpful as well when it comes to preventing a person in that household to not, you know, become infected. Now the question about, and I'll still recommend these precautions in people who have recently, you know, been infected. The science says, you know, it's very unlikely that in this situation that you're mentioning, that the first individual A will get reinfected by individual B because of the recent infection. But still, I would still use the behavioral separation if possible.
Thank you so much. That is very helpful, especially with those of us that are testing, positive in homes and one after the other and the days in between. So I think that's all. I don't see any other questions, Doctor. I don't know if you have any final words to share with our community.
No, I mean, thank you again for the opportunity. I mean, basically, I would say, vaccinations, vaccines are doing wonders in terms of, when it comes to preventing severe disease, hospitalizations, and deaths. So if you qualify for the vaccine, for the booster, age 5 and above, please do so. Get vaccinated. I do want to add, Corina, that per the website or just looking at FDA announcements, CDC, I believe Pfizer is going to be submitting their information for 6 months to 5-year-olds, data. So people are looking probably in the next month for approval for our 6 months and above population. So keep an eye out for that. Hopefully on our next forum, we'll have more information on that. And then lastly, I would say, you're seeing the news, Omicron surge, surge getting better in certain communities. There's a light at the end of the tunnel. There's, optimism, but at the same time, we don't want to, let our guards down. That's number one. Number two, we also want to go back to normalcy. So there's even some people, provider or healthcare officials and government officials looking at, how do we go back to normalcy? So I introduced all that information just to let you all know what's going on, and then in the next few days, few weeks, we'll know where we're at. But please, stay healthy and keep on doing what we recommended all this time. Thank you for your time. Have a great day.
Thank you, Dr. Solorio Cortés, for always making time for our community and answering the questions that come through. I have Olga here who says thank you as well. Thank you, Olga, and everybody else who joined us today and asking those important questions. Remember, stay masked, stay safe. Remember to take that test if you're feeling the symptoms, and or stay home depending on your situation. And until then, we'll see you in 2 weeks. And thank you, Dr. Solorio, for all the upcoming things that we get to look forward to as well, as we hopefully end this pandemic soon. Take care.
Thank you.
And
thank you.
Happy Valentine's Day too, because we won't see you before then.
Likewise.
Okay. Take care. Bye.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.